Orders of the day numbers 4 and 5.
New Zealand Public Health and Disability Southern DHB Elections Bill, Committee Stage. Taxation, Transformation, First Phase Simplification and Other Measures Bill, Committee Stage.
I declare the House in committee for consideration of the New Zealand Public Health and Disability Southern DHB Elections Bill and the Taxation, Transformation, First Phase Simplification and Other Measures Bill. Mr. Chairman.
Mr. Speaker. Members, the House is in committee for consideration of the New Zealand Public Health and Disability Southern DHB Election Bill and the Taxation, Transformation, First Phase Simplification and Other Measures Bill. I call Jamie Lee Ross.
Mr. Chair, I seek leave for the New Zealand Public Health and Disability Southern DHB Elections Bill. All questions to be debated as one question.
Leave is sought for that purpose. Is there any objection? There appears to be none. The question is that clauses 1 to 7 stand part.
Mr. Chairman.
The Honourable Annette King.
Thank you, Mr. Chairman. Mr. Chairman, Labor supports this bill. We supported the bill at the first reading and we supported the bill at the Select Committee. We supported the bill in the second reading last week. And we supported the bill because we recognised there was a problem at the Southern DHB that needed to be rectified. We supported it because it was a long-standing problem that went back to the time that two DHBs were amalgamated without the necessary work being done to see the impact in terms of the financial impact on that DHB. And we know that over time there had been huge pressure on that DHB, their deficits were growing, there was a lack of confidence in the board itself, and finally there was a lack of confidence by the Minister in the board's performance. And so there needed to be some action taken. So we supported the Minister when he put in a Commissioner. In fact, I had suggested that the Minister put in a Commissioner sometime earlier than the Minister, you mightn't remember that, but I actually did suggest it several months before you did it, put in a Commissioner. And so we supported delaying the election, the 2016 election. But because the Commission, and we did it because the Commissioners would have only been in place since the 15th of June 2015, so 11 months. And 5 months later, we would be going into an election for the October triennial election. And they won't have implemented their recommendations and they would not have implemented their plan. And I believe, and I agree, that they need time to do that. And then we need time so that when they do present their plan, that the Minister needs to be held accountable for the implementation of that plan. It comes very much back to him then, not to a board, but to the Minister, because they are his commissioners. We are concerned, and in fact both New Zealand First and the Greens, who have voted against this bill, have been concerned about the loss of democracy. And we had something like 8 submissions to the Select Committee. And those, the two from Maori submitters were not opposed to the delay in the election as so much as what representation they could have for Maori on the Southern District Health Board. The other submitters were opposed to the loss of democracy. So I wish we did not have to delay the election, because I strongly do believe that we ought to have democracy in district health boards. In fact, I was the Minister that brought back democracy to district health boards. It had been got rid of in the 1990s under the zealots that were in government at that time, and the National Party at that time, think Ruth Richardson. They had got rid of democracy but were getting rid of area health boards and putting in place a whole lot of things like, with funny names like cheese and RHAs and HFAs and so on. And when we became the government, under the Public Health and Disability Act, we brought back democracy within DHBs. And so we strongly support the ability for local people to have a say on their DHBs. And we are also concerned, Minister, that the track record of this government since they have been in power relating to ECANs has meant that when a promise was made, and a promise was made to have an election for Environment Canterbury, that when it came to the time to have that an election, it was delayed and the Commissioner's times were stretched out and delayed again until the people of Canterbury lost faith in the government's promise that there would be an election held for them. And so we have some grave fears that this will not be a delay of just one election. And so I've come to the House with a suggestion for the Minister. And of course, the Minister would have to be a big man to take it, but it is a serious suggestion. It's a serious suggestion that in fact he replaces the word cancellation and puts in place postponement of the 2016 election of the Southern District Health Board, and it be postponed until a date set by Mr. Chairman.
The Honourable Annette King.
That it be postponed until a date set by order in council. And what that would mean is, Minister, when the commissioners have presented you with the report and they have implemented the requirements that you have put upon them, there is no longer necessary to delay an election in the Southern DHB. That the ability for you, in order of council, to be able to then hold an election. Now, it might only be a year from now. No time frame has been given to us as to when the work of the commissioners would be completed. It might be a year, it could be 18 months. But why delay it if there was an ability, then having got the recommendations, having put in place what was required, that they would not then be able to minister to call an election by order in council. And I think that my supplementary order paper satisfies a number of issues. It gives commissioners time to do the work that the minister wants. It doesn't cancel an election if one could be held earlier. There's no extra cost, because if it's cancelled, the $300,000 that was cost for the last election would be used for one when it was called by the minister, and when the next election came around, we're straight back into the same timetable. And it also would meet the demands of Southern New Zealanders to have a say in the Health Board. If the Minister wasn't prepared to accept this approach, then is he prepared to follow the lead of the previous Minister of Health, who in December 2008, when he became the Minister, turned the Commissioner at the Hawke's Bay District Health Board, Sir John Anderson, into the chair of a board, and then appointed the previously elected board members to a governance board until 2010. And that was the way he'd managed a board that had been dismissed by turning the Commissioner into the chair and making the former elected members into a board of governors, a governance board. And would he consider this approach if he would not consider calling an election earlier, if everything that he has asked for has been undertaken? Because I do accept and support the Minister in wanting to have a board that is financially strong, that has the confidence of the people of the Southern District, and is able to provide the services that are so needed, able to do the rebuild of that hospital. What I don't agree with the Minister is that the Southern people have to find the money to be able to help build their hospital, when most hospitals around New Zealand have had funding from the state. But one of the requirements is they show how they're going to be able to help rebuild their own hospital. But when they have achieved all those things, Minister, that you require, why would you then delay when you could have the opportunity to say, right, you've performed what we want, you've done what is needed, I'm confident that what's been put in place works. I therefore, by order in council, will call an election for the people there. So we will continue to support this bill, Minister, but we put up a suggestion for you, and I'd like to hear your arguments as to why you wouldn't accept an earlier election. You don't have to wait until 2019 for an election if what was required is done earlier. And I'd be interested in the Minister's response to that. Also, the Minister will give an assurance that there's not a delay in an election for beyond 2019, that there's an absolute cast iron guarantee from him that this is for one period only. Because I have to tell you, there are a lot of nervous people, and I've gone through many of the press clippings from out of the southern area, written by people within the community, from doctors, from Grey Power, from nurses, from others who are very worried that this democracy has been removed from them, and it may be some time before they get it back. So it is a serious issue. But having said that, I also know how serious it is to ensure that we get a board back into a financial shape. It may mean, Minister, that the review that you've done on the population-based funding formula needs to take another look at the rural factor for the Southern District, because it doesn't make sense to me that South Canterbury have a higher per head of population funding than they do in the Southern District.
David Clark.